Welcome to Building a QAPI Framework, 12 Simple Steps. My name is Stacey Merritt Hord. I'm the Vice President of Quality with Golden Living, and joining us today is Deborah Johnson, the Senior Vice President of Clinical Services with Prestige Healthcare Management out of Louisville, Kentucky. Let's get started. Step number 1 in building a QAPI framework is leadership, responsibility, and accountability. The governing body, administrator, DON, and medical director, along with senior leaders, must create an environment that promotes QAPI and involves all caregivers. Ways to do this would be conducting QAPI rollout meetings with residents, families, and staff, selecting QAPI champions and leaders, and establishing a QAPI organizational chart. Step number 2, develop a deliberate approach to teamwork. QAPI relies on different types of teams: task-oriented teams for short-term work with a limited focus, and performance improvement projects for longer-term work. Characteristics of effective teams include a clear purpose, defined roles for team members, and active engagement from each member. Ways to develop a deliberate approach include identifying the makeup and parameters for task-oriented QAPI teams, such as a team of nurse manager formed to conduct medication path observations. Identify makeup and parameters for performance improvement project teams, such as a team of multidisciplinary staff, residents, and family members formed to identify quality of life improvement. Support QAPI teams through actions and resources. Enable staff to complete daily tasks, provide clinical care, and participate on QAPI teams. Step number 3, take your QAPI pulse with a self-assessment. To establish QAPI in your organization, it's helpful to conduct a self-assessment and then periodically evaluate the QAPI plan to assure that the organization is on track. Leadership will put together a team to complete the QAPI self-assessment. The QAPI self-assessment evaluates the extent to which components of QAPI are in place within the organization and identifies areas requiring further development. Step number 4, identify your organization's guiding principles. Establish a purpose and guiding principles that will unify the center by tying the work being done to a fundamental purpose or philosophy. Combine all of the following into the preamble of the QAPI plan. Define your mission, vision, values, and purpose statements. Establish guiding principles related to QAPI, and define the scope of QAPI. Step number 5, develop a written QAPI plan. A written QAPI plan guides the nursing home's quality efforts and serves as the main document to support implementation of QAPI. Work with the QAPI team to draft a written plan which should describe the guiding principles, reflect the unique characteristics and services of your center, be tailored to fit all units, programs, and resident groups, and create quality of life for all residents regardless of age, abilities, or needs. Step number 6, conduct a QAPI awareness campaign. Let everyone know about the QAPI plan, often and in many ways. Convey the message that QAPI is about systems of care, management practices, and business practices. Systems should support quality and/or acceptable business practices, or they must change. Identify strategies to convey the QAPI message. These include providing ongoing staff, resident, and family education, communicating your QAPI approach to consultants, contractors, or collaborators. Convey the message that every caregiver is expected to raise concerns. Convey the message to residents and families that their views are valued and desired. Share QAPI information at resident councils and in communications with your families. Step number 7, develop a strategy for collecting and using QAPI data. The QAPI team will decide what data to monitor and how the data will be systematically organized and interpreted in order to achieve meaningful reporting and action. We do this by setting performance targets and identifying performance benchmarks. Identify who and how data will be collected, analyzed, and used. Identify what performance metrics you're going to monitor. Develop a process for organizing and interpreting data. Review your CASPER reports and quality measures for areas to target, and utilize Interact 3 tools to target trends of concerns. Now I'm going to turn things over to Deborah Johnson, who will review useful QAPI tools.
Thanks, Stacy. Obviously, step number 7 is all about collecting and reviewing data. It's also about prioritizing data and determining what to work on. As we work through this, we want to remember that our focus is on who, what, where, when, and how. This process can help you compare metrics and determine your targets. Tools that can help you understand the data and analyze your process. Data gathering checklist, a flow charting or process mapping, root cause analysis, the fishbone or cause-effect diagrams, the 5 whys, the Pareto chart, the trend or run chart, the bar chart, and the pie chart. A data gathering checklist is a simple data collection tool that can help a PIP or QAPI team identify the most important cause of a quality problem. This tool is useful when the team has identified a number of causes or problems and wants to know which of these is the most important. Process mapping. In a process map, each lane is labeled with a care team or location that is critical for the process to succeed. Do not forget to include your resident. Each step of the process is placed in the appropriate lane according to who is handling that step. The process map allows the PIP team to see how many handoffs occur during that process from start to finish. Unnecessary handoffs signal inefficiencies and increased opportunity for mistakes to occur. The procedure is, once you have completed the process map, you ask the following question. Where are the bottlenecks? How can we address these? Are there inconsistencies in how the work is done? What can be standardized? Can things be done in a different order, in parallel, or by a different person, or with better quality, or at a lower cost for the same quality effect? Can steps be located closer together to reduce travel? Does each step have value? And if not, are there steps that can be eliminated? This is an example of a process map. This example shows the process of a resident receiving new medication. A minimum of 3 handoffs of the medication order occur during the process, from the physician to the nurse, from the nurse to the pharmacist, and then to the resident. If there is a question, then the handoff continues back through the nurse and the physician. Root cause analysis, or utilizing the fishbone diagram, can be fun in a team. Before creating the fishbone diagram, the desired outcome needs to be decided or the problem needs to be identified. Beginning with the desired outcome and working backward to identify the main factors that could affect the outcome and show them as the prominent branches or bones of the diagram structure. Once the team has established the desired outcome, the next step of the analysis is to consider all of the factors that support or impede progress. Begin the root cause analysis with brainstorming. The work group talks about the factors and the problem and throws out ideas. Identify where and why a system or process exists, and afterward the PIP team takes the information that they have discussed to begin to work on constructing a fishbone diagram. Based on analysis of the process, the PIP team launches new interventions designed to address the problem. The procedure is to identify the problem with the group to work on and write the problem in a box on the right side of a flip chart. Draw the fish outline, a long horizontal line, which is the backbone, coming from the box, and a series of diagonal lines or rib bones coming from the backbone. Identify the main branches with the categories of causes that you have identified in your brainstorming activity. Brainstorm for specific causes that contribute to these main branches, and clarify as needed, asking lots of questions. Develop the causes by asking why, until the useful level of detail is reached. Underneath the main branch, list all of the relevant factors associated with the branch that will influence the desired outcome. This is an example of a root cause analysis diagram. You can see coming off of the main branch are manpower, materials, methods, and equipment. And from that, they have discussed and identified under manpower that lack of staff, new staff, and agency staff might be problems to receiving cold food or late food. Under materials, they've identified lack of meal carts. And under methods, they've identified orientation of nutritional service staff. Under equipment, they identified a broken steam table. Some of these items may be very easily fixed and the root cause easily identified, and some, such as lack of staff and agency staff, may require more analysis and more working with the 5 whys to drill down to root cause. Root cause analysis, or 5 whys, let's take a closer look at that. This is another method of completing root cause analysis by making a table that asks a series of questions again and again. The analysis repeatedly digs up deeper by asking why, then when answered, ask why again, and so on until the cause of the issue is determined. There are many tools for this, but you can just use flippy paper. The procedure is to write down the specific problem. Writing the issue helps you formalize the problem and describe it completely. And it also helps the team focus on the problem. And it will also allow the team to help you identify what they believe the problem really is. Then ask why the problem happened and write down any answers that you get from all your team members. If the answer you get doesn't provide or identify the actual root cause of the problem, then ask why again and write that answer down. Loop back to number 3 until the team is in agreement that the problem's root cause is identified. Clarify that sometimes it's 6 whys and 7 whys and 8 whys. This is an example of the 5 whys tool. You can see the problem statement and then why, and why. A Pareto chart is a tool that helps the team see what the cause or problem occurs most frequently. The chart plots out the activities or areas that contribute most to poor quality. The Pareto chart is based on the theory that a small number of causes have the largest contribution to poor quality and allows us to focus on what really is important and what will make the most impact on quality care. When a few activities contribute to the most of the problem, it is called the Pareto effect. A classic Pareto effect is observed when 20% of the causes contribute to 80% of the overall problem. The procedure involves capturing the data in the checklist onto a table in descending order. From the table, we calculate the percentage of frequency and the cumulative frequency. Plot the information on a bar chart where each vertical bar represents a different cause or a different problem, and the left vertical axis represents the number of causes and problems. Identify the bar where the cumulative frequency is high relative to the number of categories. Look for the Pareto effect, where the first few categories account for most of the problems, and there you should spend a good amount of time. This is an example of a Pareto chart for blood work not being completed. There are reasons for the blood work not being completed labeled A through G, and you can see label A and B being the most often observed concern. Frequency count shows that A and B are high and should be worked on for trend or run charts. A trend chart gives you a visual representation of data over a period of time. It is also used to establish baseline performance, identify specific cause variation, and to compare members of a group with each other. Trend charts often include a line representation, the average or mean of the data. The procedure is to gather in chronological or sequential form. Measurements must be taken over a period of time. Divide the data into 2 sets of values, X and Y. The values for X represent the time intervals, and the values for Y will represent the measurements taken. Plot that data for each time interval. If an average or mean line is to be used, calculate and plot average or mean is equal to the sum of all data points divided by the number of data points. Example, 2, 5, 4, and 9 equal 20. 20 divided by 4 equals is an average of 5. Connect the points for easy visualization. Trend or run charts look like this. You can see the data points. You can see the trend line going down. You can see where a change was made, and then you can see the outcome utilizing data points in the month 9 through 12. A bar chart. A bar graph is a chart that uses either horizontal or vertical bars to show comparisons among categories. One axis of the chart shows the specific categories being compared, and the other axis represents a discrete value. Some bar graphs present bars clustered in groups for more than one, and others show the bars divided into subparts to show a cumulative effect. The procedure is to determine the discrete range, examine your data to find the bar with the largest value. This will help you determine the range of the vertical axis and the size of each increment. Then label the vertical axis. Determine the number of bars, examine your data, and how many bars you will chart. These may be single, grouped, or stacked bars. Use the number to draw the label and the horizontal axis. Determine the order of the bars, and the bars may be arranged in any order. A bar chart arranged from highest to lowest incidence is called a Pareto chart. Normally, bars showing frequency will be arranged in chronological time sequence. So draw the bars. And this is an example of the bar chart. This one is identifying percentage of medication errors by month. The pie chart. Pie charts, a form of an area chart, are an easy way to visualize percentage breakdowns of a total. They're useful for analyzing polls, statistics, and managing money and data. And they make an excellent visual display for explaining data to other people. The procedure requires you calculate pie chart proportions, gather your numerical data, and label information and write it down with one data point per line in descending order. Add all the data together, calculate the tool. This number will be your denominator. Calculate the percentage of the total for each data point by dividing each one by the denominator calculated above. Calculate the angle between the two sides of each pie. To do this, multiply each percentage, still in decimal form, by 360, the number of degrees in a circle. Utilize the charting capabilities in Microsoft Office, Excel, or Word. To complete this manually, use a mathematical compass to draw a circle. To draw a pie chart accurately, you will need to start with a perfect circle. This can be done using a compass and a protractor to measure the angles. If you don't have a compass, try tracing a circle template using something round, such as a lid or a CD. Draw the radius and start in the exact center of the circle and draw a straight line to the outside of the circle. Place your protractor on the circle, position in the circle so that there's a 90-degree crosshair situated directly above the center of the circle. The 0 point should be vertically aligned along with the plot line. Draw each section division. Draw the sections by making the first division against the edge of the protractor to the correct angle, using the angle formulation you got in the earlier step. Each time you add a section, the radius changes to the line you just drew, and rotate your protractor accordingly. Color each segment. You can use color, patterns, or just words, depending on what meets your purpose best. Add the name of each section and the percent it represents in the chart. This is an example of reasons for a catheter. Group techniques. Other group techniques are always helpful. Brainstorming is used to generate many ideas in a short amount of time. Ideas suggested while criticism and evaluation is avoided. The objective is to get everybody to participate and list their ideas on a flip chart to get the best outcome. There are also some nominal group techniques to generate a list of options for structured decision through the contributions of group members working individually, giving the information to your team members, allowing them to think through it, write things down, and bring back to the group. Multi-voting is used to select the most important popular topics from a list with a limited group discussion and difficulty. Structured discussion is used to gain group consensus on a list of ideas and topics. High volume, high risk, problem-prone, and high-cost issues are discussed to prioritize those things that have the largest impact on resident care and they should be addressed first, and resources are utilized appropriately for this.
Thank you, Deborah. Step 8 in building a QAPI framework. Identify gaps and opportunities. Review sources of information to determine if gaps or patterns exist in systems of care that could result in quality problems or opportunities for improvement. Conduct gap analysis to identify areas for improvement. Determine who will review data and how often. Identify how the data will be used to improve the organization, and select areas in need of improvement to monitor. Step 9. Prioritize quality opportunities and charter performance improvement project teams. Prioritizing opportunities for improvement is a key step in the process of translating data into action. Prioritize work based on priority, areas that affect residents first, and high risk and opportunities for improvement. Prioritize work based on priority, areas that affect residents first, high risk areas, and opportunities for improvement. Charter PIP teams to address in-depth issues and establish how the PIP team will function. Assign team leaders, timeframes, resources, budget, etc. Have each PIP team establish a SMART goal. Remember, SMART goals are specific, measurable, attainable, realistic, and have a time frame. Step number 10, plan, conduct, and document PIP teams. Careful planning of PIP teams includes identifying areas to work on through comprehensive data review, which are meaningful and important to your residents. It's important to focus PIP teams by defining the scope. Utilize a problem-solving model to organize the work of the team. Focus the work and create realistic time frames. Identify and provide information, supplies, or equipment. Select measurement tools and plan how the results will be documented. Identify a steering committee to oversee and guide the work of the team. And teach problem-solving methodology such as plan, do, study, act. Step number 11 of building a QAPI framework. Get to the root of the problem. Process improvement requires getting to the root or heart of the problem or opportunity. Provide staff and management with root cause analysis training. Utilize root cause analysis to thoroughly explore all possible causes of the problem before choosing a solution. Multiple factors may be the basis of the problem, or the problem may be a component of a larger issue. Understand if and how the problem impacts all departments center-wide. Step 12, take systematic action. Implement changes or corrective actions that will result in improvement or reduce the chance of the event recurring. Classify possible actions. Weak actions depend on staff training or new policy. Intermediate actions depend on staff remembering to do the right thing. Strong actions change or redesign processes and have built-in warnings to prevent problems from occurring. Ways to take systematic action. Pilot test strong actions before launching them center-wide. Monitor for any unintended changes. Evaluate effectiveness of actions using those evidence-based tools. Launch changes center-wide. Reevaluate outcomes periodically to ensure integration. For more information, there are several resources available. The 12 action steps from CMS are available on the ACA website. There's also the AHCA Quality Initiative website and QAPI website. There's a sample QAPI plan or performance improvement plan on pressure ulcers on the AHCA website. CMS.gov has QAPI at a glance, nursing home quality assurance and performance improvement, and additional QAPI resources. There are many resources again at www.acancal.org. There's also Long-Term Care Trend Tracker, Nursing Home Compare, and of course our quality improvement organizations. Additional resources: Advancing Excellence, the American Society for Quality, Agency for Healthcare Research, and the Institute for Healthcare Improvement. Thank you for joining us today to learn about building a QAPI framework in 12 simple steps.